Moms First, a 20-year journey.
I will always be a mom first.
This year, Cleveland's Healthy Start Project celebrates its 20th anniversary. As I reflect back upon the successes and challenges of the past 20 years, it gives me great satisfaction to see the impact that the program has had in our community. The project began in 1991 as a demonstration program whose charge was to develop a community-based approach to reducing infant mortality by 50% over 5 years while improving the health and well-being of women, infants, children, and their families. It was an ambitious goal, but the Cleveland Healthy Start Project was up for the challenge. The project targeted 15 neighborhoods whose infant mortality rates mirrored those of third world countries. At that time, for every 1,000 babies born, 23.3 died before ever reaching their first birthday. Since its inception, MomsFirst has served over 19,000 families. That means that 19,000 families have received health education, assistance with accessing medical care, and needed referrals in the community. Over 90% of the Healthy Start participants are African American. And that's because nationally, African American babies are over twice as likely to die before reaching their first birthday than white babies. Not only is the high incidence of low birth weight births and infant deaths a source of inequality, but it comes with a high cost socially and economically for our city and all Americans.
Cleveland is fortunate to have a large, comprehensive network of resources in its perinatal health care system. Yet, in 1991, the majority of these resources were out of reach for the MomsFirst target population. Medical services were highly fragmented, and support services, which enhance access to care, were lacking. During the 1990s, the city witnessed the closure of 3 area hospitals in low-income areas, including the closure of 2 major birthing hospitals used by the indigent population. The MomsFirst Consortium was a catalyst for collaboration and integration to ensure that the most at-risk women were linked to health care and to a medical home. Today, the consortium continues to serve as a central point for the discussion and dissemination of information relating to maternal and child health in the greater Cleveland community.
Over the years, the project has matured and the goals have been modified, but the guiding principles remain the same: improving birth outcomes among Cleveland's highest risk women and reducing infant mortality. The 3 most common measures of poor birth outcomes are the infant death rate and rates of low birth weight or very low birth weight births. Therefore, the most significant indicator of the Cleveland Healthy Start Project success has been the decline in the infant death rate among project participants and the stabilization of low birth weight and very low birth weight births. Some additional performance measures include soliciting family participation in MomsFirst, incorporating cultural competence into project activities, finding a medical home an ongoing source of care for both mom and baby, ensuring that medical and social service referrals are made and followed up on, engaging women in first trimester prenatal care, improving breastfeeding rates, and reducing sleep-related deaths.
In 1995, Cleveland received its largest annual federal award in the amount of $7,343,899.
The Cleveland Department of Public Health contracts with agencies which assist low-income minority populations to implement the MomsFirst project. These subcontractors carry out all direct services with participants, including outreach and client recruitment in Cleveland neighborhoods, the Cleveland Municipal School District, jails, juvenile detention centers, homeless shelters, and residential substance abuse treatment facilities. Home visiting is conducted with program participants by community health workers, and the consortium engages a wide variety of community partners and addresses a range of issues important to the target population.
What Moms First does is we provide support and home visitation to pregnant women that live within the city of Cleveland. During pregnancy, we want to link the mother to prenatal care, ensure that she can get to all of her appointments, and try to meet any of the other barriers that she may have, such as education, nutrition, making sure that she has family planning, things of that nature. And once the baby is born, we want to assist her to getting to her immunizations, work on family planning, and try to ensure that she's actually doing proper birth spacing, which the ideal time is 2 years in between pregnancies. We've actually last year served over 2,300 women in the city. And over a third of our participants are actually teens. So we're involved very much so with the teens, with the adults. We actually provide services to women who are incarcerated, also in the homeless and substance abuse shelters as well.
I will always be a mom first.
Over the past 20 years, Cleveland's population has decreased. The city's racial composition has also changed. In addition, the most recent census data indicates that Cleveland's poverty rate is also increasing. These changes mean that there's a greater and heavier reliance on public initiatives to address the needs of Cleveland's citizens. Government agencies, private nonprofit organizations have collaborated to form a health and social services safety net within the community. Yet in spite of all of these changes, the infant mortality rate had continued to increase. The Moms First program establishes community partnerships as well as developed specialized service models that allow us to reach out to those moms who are at greatest risk of experiencing a poor outcome. This means adolescents, women who are homeless, those who are incarcerated, and perhaps those also who are experiencing substance abuse. The long-term objectives of the Moms First project include reducing the infant mortality or infant death rate, reducing the rates of low birth weight and very low birth weight among its project participants. The combined 6-year infant mortality rate for the Moms First project is actually 8.4. This is over a period of 2005 to 2010. This is actually much lower than the infant mortality rate for the city of Cleveland and for Cuyahoga County. Moms First, through a combination of services that includes outreach, health education, perinatal depression screening, interconceptional care, all of these factors has contributed to these positive outcomes.
Faced with reductions in funding in 1996, several changes were made to the project. A risk assessment process was initiated in 1996, and since that time, only high-risk women have been enrolled into the program. The Infant Mortality Review Team stopped collecting data and concentrated on data analysis and the development of recommendations. The consortium remained intact, with the larger consortium and neighborhood consortia continuing to meet. However, changes among subcontractors have been made over time to ensure the highest quality of service delivery and cultural competence for participants. As the project matured, core services and delivery approaches have been refined to address the needs of the target population. Family planning, interconceptual care, and women's health care in general is now emphasized with program participants. The project created important collaborations across the county and has leveraged state, local, and private foundation funding to increase available resources for participants. Recently, improvements in health literacy and providing additional support for breastfeeding moms have become priorities. Professional development for staff continues to be ongoing, as community health workers and case managers are the face of the project. Their bond with participants is key to engagement and retention in the project. Throughout its history, Moms First has proven to be adaptable to the needs of the target population. In 1997, the project added a mobile medical unit, the Health Mobile, to help with outreach and recruitment, community education, and health screening. Since 2004, Moms First has collaborated with Planned Parenthood of Northeast Ohio to provide reproductive health services to the community on board the Health Mobile. Moms First works with pregnant women to ensure that they have healthy babies, and one way to make sure that they have healthy babies is to make sure that they're healthy themselves. So taking care of themselves, getting themselves checked for HIV and STDs, as well as their partner checked for HIV and STDs, can reduce the likelihood of them passing anything on to their unborn child.
In 2002, the project changed its name to MomsFirst to eliminate confusion with other local programs and to highlight its emphasis on maternal and child health.
I will always be a mom first.
In addition to targeting the highest risk women, MomsFirst expanded in other significant ways. Evaluation data revealed that birth outcomes improved in most of the 15 neighborhoods where the project was active, while infant death rates in the remaining neighborhoods worsened. In 2001, MomsFirst changed its project area to include the entire city of Cleveland, focusing on those neighborhoods with the highest infant death rates. In 2001, the project began to emphasize interconceptual care and created a perinatal depression screening tool and referral process for all program participants. In 2002, the project conducted the area's first assessment of perinatal depression among African American women. Through a contract with the Cleveland Regional Perinatal Network, MomsFirst has led the way in educating provider networks to recognize and manage mental health issues and develop a plan of care. Subcontractors were not originally community-based agencies. During the 2005 to 2009 project period, subcontracts with neighborhood settlement houses and community centers began. MomsFirst entered into partnership with Invest in Children in 2006 to develop a joint service delivery model with Help Me Grow, expand the capacity of the MomsFirst project, and enhance services for pregnant and parenting teens. MomsFirst now takes a life course approach to dealing with the issues of poor birth outcomes. This approach assumes that disparities in birth outcomes are likely influenced by early life experiences and the cumulative effects of lifelong stress. In adopting this perspective, the project widened its view on what impacts women and children's health. Additional new components included enhanced family planning education, the creation of reproductive life plan tools, and healthy weight linkages and referrals.
It's important for me to recognize the 20th anniversary of the MomsFirst program. And to that end, I want to present this proclamation to the organization and tell them how much I appreciate the work that they've done over the last 20 years in reducing infant mortality, low birth weight babies, and to getting prenatal care to parents and mothers throughout the city of Cleveland. So thank you very much, good luck, and look forward to another 20 years.
I'm Sherrod Brown, your United States Senator. Congratulations to everyone at MomsFirst, the staff, the volunteer, the supporters, for 20 years of service to the women and the children and the families of Cleveland. You've given safe harbor to women facing high-risk pregnancy, women who often have nowhere else to turn. You've educated them about their nutrition and their well-being. You've helped them with insurance and with home care in ensuring they have transportation for prenatal to postpartum appointments. It's because of your advocacy that we reauthorized the Healthy Start Act, which helps communities reduce rates of infant mortality and health disparities. And it's because of you that we can stand up to big pharmaceutical companies when they gouge prices of critical medicine for women facing high-risk pregnancies. With your support and your stories in mind, I was proud to confront KV Pharmaceutical when it tried to hike the price of the critical progesterone drug Makena. Today, the price has been reduced, but there's still much to be done. We must strengthen Medicaid and protect it from arbitrary cuts. We must raise awareness about ways to prevent birth defects, which is why I'm a co-sponsor of legislation that would provide grant funding for pregnancy risk information centers. And we must continue working together following the lead of MomsFirst in its 20 years of service and of sacrifice. Your work without adulation or without the limelight teaches a city the meaning of empathy and compassion and care. For that, I thank you. As your senator, I couldn't be more proud.
We're very fortunate today to have an actual participant from the MomsFirst program. We have Amia Fothergill, who's here to tell us a little bit about what the MomsFirst program has meant to her. Amia?
Yes, hi, how you doing? Well, what MomsFirst has meant to me is great opportunities for me and my developing baby. And also for when after the baby is born, the resources that they have also. I would say that the different types of resources that it has allowed me to gain is access to our different programs and entities out there, making sure that I'm comfortable in the hospital process and what to expect as a new mom.
It's almost like having a best friend.
Absolutely.
Well, would you recommend this program to others?
Of course I will. I mean, the MomsFirst program is a benefit to all the young mothers out here who are weary about what's going on with the pregnancy, and also to give them some access to know what to expect.
MomsFirst is like Cleveland's baby. We've given birth to it, we've nurtured it, and watched it grow. We survived the ups and downs of adolescence, and now we're in our prime. Just like raising a child, we've learned a lot of lessons along the way, and we strive to build upon them to improve the quality of our services that we offer the community. MomsFirst community health workers are an important link in the Cleveland Social Service Network because they make one-on-one home visits to provide educational, medical, and social service resources to parents who want to give their children the best start in life. In the words of one participant, my MomsFirst worker is like a big sister helping me become a better mom. MomsFirst gives me hope. MomsFirst will continue to ensure that Cleveland babies are born healthy, but we can't do it alone. And I'd like to thank all of our partners for supporting us over the last 20 years and believing as we do that every child is precious and deserving of a healthy start in life. Thank you.